We're tracking COVID trends in the Commonwealth. Hospitalizations are slowly ticking back up. More than 550 people are in the hospital fighting this virus. Officials at the health department haven't released the number of new COVID cases today. That's because this is a holiday, but the positivity rate is around 17%. COVID cases keep spreading in the Commonwealth.
Fewer cities are under a low CDC community level, but Alex Littlehales reports why current projections don't show signs of slowing down.
The data speaks for itself. These are the areas in Hampton Roads that are now under a medium CDC COVID-19 community level. Virginia Beach, Chesapeake, most of the peninsula, and more. The region hasn't reached what's considered a high threshold yet. But according to the Virginia Department of Health and the University of Virginia's Biocomplexity Institute, there are now 27 Virginia localities that have reached high status. It means changed CDC guidance for the people living in those areas, like masking indoors no matter your vaccination status, and rethinking how you spend your time indoors if you're immunocompromised.
This is one of the reasons that we are seeing higher percentage rate because we are doing less testing.
Rudy Patel runs Arc Point Labs in Virginia Beach, a testing lab off Pembroke Boulevard. His lab has personally seen lower demand for testing, but the number of those coming back positive is higher.
The trend is higher. The positivity rate has definitely increased, and we are seeing as high as 10 to 12%.
In more than half of the places you travel in Virginia, you'll not only find these changing community levels, but changing case counts too. Another VDH metric shows every health district in the Commonwealth is in the middle of a slow growth or surge outlook. For example, in Hampton Roads, you'll see the entire region is marked red to show it's in surge. It means there is no longer a place in Virginia where cases can be considered declining. In Norfolk, I'm Alex Littlehales for 13 News Now.
And the latest modeling from Virginia Department of Health projects the latest BA.2.121 variant will cause hospitalizations to peak around mid-August. Those same models say the peak could slightly exceed what we saw earlier this year.